Hi all, my name is Megan Daly, and today I will be presenting research on the multi-state outbreak of Salmonella Saintpaul infections that were linked to raw alfalfa sprouts consumption. Salmonella is an illness caused by infection from Salmonella bacteria. These Salmonella bacteria can be present on many different surfaces and can spread through contact with animals. Improper food handling techniques and poor hygiene practices like not washing one's hands or the tools used to prepare food with, as well as eating raw or undercooked foods. Side effects of Salmonella include fever, aches, and gastrointestinal issues like nausea, cramps, and diarrhea, amongst other side effects. This case centers around an outbreak of Salmonella Saintpaul bacteria that occurred between the 1st of February and the 15th of April in 2009. The outbreak was distributed amongst 14 states where 235 people were infected and 3% of them were hospitalized. Those infected included those under a year all the way up to 85 years of age. Of all infected, 68% were female. The outbreak was first reported by the Nebraska Department of Health and Human Services after they noticed high incidence of Salmonella in patients and reported this to local public health officials, who then launched a nationwide investigation with help from the CDC, whose mission it is to control the spread of diseases. A strength in this case was public health officials' ability to narrow down the restaurant, growers, and seed distributors through several effective investigation methods. A weakness was that because there were so many different growers and seed companies involved in the outbreak, it took months to control and over 200 people were infected, and some of whom were infants. This case is an opportunity to educate the public about the dangers of consuming raw, unwashed foods, and is also an opportunity to regulate sanitization methods of businesses who are growing and distributing food for consumption. Some threats to public health include a lack of awareness of how to properly clean and cook foods that have potential to be contaminated, as well as a lack of awareness around which specific alfalfa sprouts have been recalled. The Salmonella outbreak was caused by Seed Company B, who had sold and distributed several batches of contaminated alfalfa seeds. Many sprout growers did not sanitize the seeds effectively before using them to grow alfalfa sprouts. Restaurants in this multi-state chain did not use proper cleaning practices and served undercooked alfalfa to customers. Many of the 235 infected patrons did not seek medical care and did not report their symptoms to public health officials, which caused difficulty in tracking them down across several states. The CDC developed alternative solutions based on the health belief model. The health belief model centers around a person understanding that they are vulnerable to Salmonella infection, Salmonella is dangerous, and that by taking preventative measures, they can protect themselves from contracting Salmonella. The CDC solutions involved providing information on why Salmonella infection should be avoided. On April 26, 2009, the CDC recommended not eating alfalfa sprouts at all until they can narrow down the source, and if they were to be eaten, sprouts should be washed thoroughly and not eaten raw. Seed Company B stopped selling alfalfa seeds from the contaminated batch entirely on May 1st to prevent the spread of Salmonella amongst the produce. By May 8th of 2009, the outbreak was considered to be over. I recommend that the FDA designate higher quality standards and put policies in place for alfalfa seed growers. The companies and restaurants who sold the alfalfa sprouts should be investigated and have their sterilization methods be regulated by FDA monitoring systems. If they do not comply and meet these standards, they should be penalized. Another recommendation is to have grocery stores pull any sprouts from these companies off their shelves, as it is difficult for customers to distinguish which sprouts are involved in the recall. Grocery stores should also post notices about proper cleaning and cooking practices in the produce aisles or throughout the store to educate customers about the dangers of eating raw, unwashed foods. My proposed action plan is to have employees be retrained on their proper food handling techniques. By July of the same year, grocery stores should be required to post signs with recall information. By 2024, companies should be required to publish any recall information on their websites and in any advertisements to alert customers before they buy their products and are potentially exposed to contaminated foods. By the end of 2025, there should be improved standards for seed and sprout growers' disinfection methods, along with FDA-backed monitoring systems to regulate these methods. My final thoughts are that we should prioritize educating the populace of how dangerous Salmonella can be, as it is a deadly illness. I believe that there should be more focus on the disinfecting practices of seed growers who initiated the outbreak. Very few seed growers sanitize the seeds they purchased, and even then the practices weren't effective. Restaurants in this chain and others should be retrained on how to properly disinfect food before it reaches the customers. There should be monitoring systems in place that hold these businesses to higher standards and penalize them for putting the health of consumers at risk. Thank you all for your time. Thank you all for your time.